The whole system of care is a complex adaptive one, made up of multiple services across and within organisations, governed by a complex array of rules and governance arrangements. Similarly, managing the complex heterogeneic needs of frail older people requires integrated and coordinated care and support. Carmarthenshire have had an integrated management structure for older adult services for some years, and as the head of integrated services for Carmarthenshire County Council and Howell Valley University Health Board, I was very aware that social care and health objectives and plans, if considered and delivered in isolation, could impact negatively on outcomes for our frail older population. This was particularly represented in relation to unscheduled care. Long lengths of stay resulted in deconditioning of older people. Deconditioning increases the demand on a finite social care resource, and a depleted finite social care resource causes delays in transfer from hospital and more harm, but will also compromise care availability in the community for frail adults at risk of hospital admission. Increased admission rates result in demand exceeding capacity in our acute hospitals, leading to ambulance delays and an inability of this emergency service to respond to emergencies in the community. We recognised that existing unscheduled care measures neither represented whole system or outcome on an individual level. Yet, crucially, improved outcomes for older people was the absolute goal for both health and social care organisations. Taking a whole system care pathway approach provided a potentially transformative approach for bringing simplicity to the complexity that's inherent within complex adaptive systems. And this recognised that effective organisational collaboration and partnership was absolutely critical to success, and improving outcomes for older people, particularly those with frailty, is wholly interdependent on the synergy between health and social care in meeting the holistic needs of this vulnerable group. This work took an ends-to-means approach, focusing on the end result and outcome you want for that population first. And for us, this was well-being and independence for the frail older adult group, regardless actually of the level of frailty. Then reflecting on the means by which this can be achieved by focusing on what we know works, the services, interventions, standards, and what the evidence base suggests we should implement to achieve the outcome and what matters to the person. This provides a disciplined way of embedding outcome-based decisions making into planning, delivery, and accountability for partners, clearly connecting organisational and service processes to achieving something that matters. Shared measures for improvement galvanises the contributory relationship of multiple partners to achieving a shared outcome for a population. This then avoids falling into the trap of trying to hold individual services to account for population-level change that can only be achieved by integrated and collaborative efforts, enabling accountability to be attributed appropriately across partners. It allows us to tell the whole system story behind our baseline. Defining the measures that underpin the means was supported at national level by an expert reference group consisting of senior clinical and managerial representatives across local authorities, health boards and Welsh Government. Testing and implementing these performance measures locally was challenging but valuable. Please welcome Deborah Llewellyn, Modernisation Programme Manager, to the stage, who will present on how we got there.